Hello and welcome to another McKnight's Thought Leadership webinar. You're tuned into workforce strategies to get your community ready for growth. I'm McKnight's Long-Term Care News Executive Editor, Jim Berkland, and I'm your moderator. We find that the most progressive providers in the long-term care space, and maybe in almost any business, are those that are continually focusing on growth, even in deeply stressful times. Combining that line of thought with today's workforce challenges is what today's webinar is all about. We'll be getting into that and looking into areas of opportunity. And perhaps most valuable of all, this is going to be way more than just abstract theories. We'll be hearing from the leader of a provider organization who has made an amazing and successful transformation. We're talking real workforce efficiencies and big buck savings. So you're definitely in the right place today. Now, I'd like you to meet our presenters. Brandon Tappan has been a licensed nursing facility administrator for more than 15 years. Before joining ShiftKey, he spent 12 years leading large multi-facility and multi-state operations across the post-acute healthcare space. Nicole Kumala is Vice President of Operational Support at Touchstone Communities. She has 20 plus years experience in leading the development and delivery of quality person-centered healthcare and has vast experience in workforce management, including scheduling and staffing, as well as virtually all aspects of healthcare operations such as budgeting, regulatory affairs, and so on. Peter Corliss is a widely recognized expert in post-acute care human resources. He's worked for top providers around the country and has held posts including Chief HR Officer for major players such as Genesis and Kindred. He is currently Executive Vice President of Enterprise Development for OnShift. Well, Peter, I have to say there are probably some people thinking out there, good grief, we're going to talk about growth. I just want to get this week's shifts filled and then maybe next week's. So what could you tell those people right now?
Well, Jim, you're 100% right. This is an incredibly challenging time. But if we look at the demographics and the growth of demand for our service, it's only going to increase. Workforce issues are challenging, no doubt. But we are seeing providers who are responding and finding creative ways to respond and grow their workforce availability. And that's what we're going to focus on today.
All right. Well, sounds like a great jumping off point. If you're ready, why don't you take it away?
All right. Well, thank you, everybody, for joining us. We appreciate your being here. Our agenda today, we're going to be talking about the current and future state of senior care, identifying areas of opportunity for you to grow your workforce. And then we're going to go through and, as Jim said, Touchstone will be talking to you about their workforce transformation and how they're dealing with those challenges today. And as the three presenters, we'll be going back and forth talking about the different slides. So no doubt inflation has been significant headwind over the last year. In addition to the impact on our increased wage rates, we've seen labor costs increasing beyond that. A recent Vizient operational database survey identified that from 2019 to 2022, there's been a 20% increase in nursing overtime hours. In addition, providers have been offering premium rates and incentives such as pickup shift bonuses to encourage employees to pick up additional shifts. They've been turning to outside staffing agencies. In 2019, about 3% of all labor was through a staffing agency. In 2022, that went up to 11%. So that's obviously impacting higher workforce costs. But it's also creating scheduling challenges for those who are trying to create and manage a schedule, trying to do things like make sure that all the hours are counted for PBJ reasons. And at the same time, the financial aid that we received from the COVID-19 public health emergency is ending. Last week, CMS issued their proposed rule for minimum staffing for skilled nursing. Right now, there's a 60-day comment period where providers are being urged to comment on the proposed rule and the difficulty that we'll have trying to meet the new standards. Those standards are for RNs that there's a minimum 0.55 hours per patient day, and for CNAs, a minimum of 2.45 hours per patient day. Together, that would require a minimum of 3.0 between them. That wasn't as bad as the 2001 study that CMS issued, which had recommended a 4.1. But you have to keep in mind that this 3.0 only is for RNs and CNAs. There are not LPNs included. Once you factor in LPNs, that standard, the amount of labor that you're going to have to be providing could be significant. The one good thing is that there is a phase-in period for meeting that standard. For non-rural nursing homes, they have 3 years to comply, and rural nursing homes have 5 years to comply. Now, keep in mind that the definition of rural or non-rural is provided through the Bureau of Labor Statistics. 80% of all facilities are considered non-rural and only 20% are considered rural. So you'll want to look at where you are within the Bureau of Labor Statistics definition to see which you are. The rule also required a 24/7 RN coverage. Currently, only about 20% of communities would meet that standard. Again, there's a phase-in period of 2 years and 3 years in order to meet that requirement. CMS is soliciting comments on these, as I mentioned, and you're urged to send in letters to CMS letting them know how this would impact you and your ability to provide coverage and your ability to be able to staff your building. 75% of nursing homes would need to add staffing to reach the proposed compliance level. Also, it's unfunded. They estimate the cost will be $4 billion over 10 years, and they didn't provide any additional funding for that $4 billion. There are hardship exemptions, but the way they're written, they would be extremely difficult for facilities to meet. So that's a problem. And then there are penalties for not meeting the new standards, including civil money penalties, state appointed monitors, or even denial of payments and closing. The one other thing that's included is that facilities have to develop evidence-based staffing assessments that are going to be very, very onerous for facilities to be able to develop, looking at their local labor market and labor availability, and how they can meet the standards or not meet the standards is going to be very, very challenging to develop and maintain. So associations are looking at the options of legislation over the phase-in period and litigation over that in order to try and affect the rule. But the best way to affect it is to send in comments over the 60-day period. CMS will then have a period of time, which will probably take them till mid-2024 in order to come out with the final rule that we can see just exactly what this is going to look like. So with that, Brandon, I'll turn it over to you to comment on the next slide.
Yeah, thanks, Peter. Building on what you shared, I want to first state that you aren't alone in these challenges. The healthcare worker crisis impacts us all, and it has ripple effects throughout the entire healthcare continuum. Here are just a few stats from the American Healthcare Association. There's roughly 72% of facilities in a recent survey that are very or somewhat concerned that they'll have to close their doors or units because of persistent workforce challenges. In their Access to Care report, they shared that labor shortages have already led to 21% of operators downsizing, 24% of facilities dropping those beds or closing units or a floor, and 55% of nursing homes having had to turn away prospective residents and patients, or 48% having wait lists of several days or more. And that's really what we want to focus on today, is the importance of your community's ability to receive those patients, not only for your economic benefit, but of course for the health of the entire healthcare continuum. While there are numerous facilities that are declining in patients, those equipped with the right tools and access to independent professionals, they can effectively address patient demand so they can support this occupancy growth that's on our horizon.
Okay, so building on what Brandon said, the significant workforce challenges are creating issues in terms of trying to manage those schedules. 61% of employees have reported that they're moderately burnt out or stressed Often that's because they're having to pick up additional hours, additional shifts, work double overtime, that sort of thing. And employees have indicated that having a more flexible schedule is a significant workforce benefit they're looking for. So employees are burning out due to prolonged overtime, inflexible scheduling. There's reduced productivity and increased stress as many healthcare workers have left the industry. And according to the American Nurse Foundation, 34% of nurses expressed that they're not feeling emotionally well. One of the issues that providers face is disconnected systems. If they have multiple systems that they're using to try and staff a building, from their internal staff to juggling the use of external agencies and contingent workforce, it's leading to scheduling issues and increased labor costs. We have one organization that said they were taking in excess of 10 hours a day to find people and to keep themselves fully staffed. So the lack of dedicated scheduling tools can contribute to inefficiencies. So skilled nursing providers need to adapt to these workforce software challenges and solutions to simplify scheduling for both the facility and the employees, provide employees with more flexible schedule choices, and then proactively manage coverage and cost. Brandon?
All right, there's reason, though, to be very optimistic about our future. And that opportunity will be the necessity that drives innovation. So despite these workforce shortages, staffing shortages that we're all facing, the demand for skilled nursing and assisted living is growing. Skilled nursing and assisted living facility occupancy rates have increased, and they will continue to do so. They're forecasted to increase well beyond those pre-pandemic highs we experienced. In addition, on October 1st, we know that Medicare rates are increasing by 4% for those skilled nursing facilities. That's the largest increase in quite some time. And many states have had success in increasing their Medicaid rates in state budgets, and more so are being successful in that effort. So facilities that want to enter growth mode need to ensure that they're ready to meet this rising demand. I want to advance here and share with you a bit of a math problem. You need to be continuously recruiting for one thing. Don't wait until someone quits to start or to adjust your recruiting process. We need to continuously working to build our workforce. And using temporary workers is a great way to enhance your recruitment effort. Those temporary workers can handle business continuity while you stay on track with your plan. The cost of turning away residents is truly greater than the cost of engaging with an independent professional. That temporary cost, just for example, if your community is taking up to 30 days maybe to hire and onboard properly a new clinician, and you restrict admissions until that's possible, you could be excluding your community from the revenue capacity of up to 10 more skilled patients with a gross revenue potential of $180,000 in a 30-day period. Facilities have had great strides in employee hiring and retention. Some of these workers are returning to our workforce in post-acute. If they want to stay on track during this growth mode, they'll need to use extra resources. It's also critical to keep up good hiring practice and continue your training programs, as I know Nicole will go into, to persistently focus on reducing that employee burnout. But don't trade the opportunity for for the comfort in the status quo or minor savings in the short term, nor trade the cost of increased turnover. Fully credentialed independent professionals are a great resource to stay on track with your plans and realize a more stable and economically successful operation.
So what you need to do is you need to look at the availability of the total labor force. You have full-time employees, you have part-time employees, you have casual employees. Many of the organizations we deal with have developed an internal float pool, especially where they have multiple facilities within the same local labor market that they can float people between buildings. But when those aren't meeting your needs, you need to look at whether you can bring in a contingent laborer to fill that. You need to look at what it means to work a shift. We have a lot of our customers who are offering split shifts, partial shifts, different ways of scheduling, trying to encourage people who may have left the labor force to come back in and work for them on a casual basis. So flexible schedules give employees more options and you more options to employ and embrace and have them working for you. So who is part of your workforce? All those people that I just mentioned, including independent professionals who are essential for occupancy growth and not denying admissions in order to provide the exceptional resident care that you want to and reduce employee burnout for your existing employees. You want to look at your employee benefits, beyond healthcare and PTO. What sort of recognition, feedback, and rewards are you providing your employees? What sort of financial support, such as access to earned wages between pay periods, training for your leadership in order to make sure that you're providing the best empathetic leadership that you can to your employees, as well as mentorship programs, career ladders, those sorts of things to be an employer of choice that people want to stay with. And then look at your workforce technology. Is your workforce technology helping you? Is it built in order to assist a scheduler to get a clear view of the schedule into the future? Is it built for frontline workers to be able to easily look at open shifts and pick up shifts? Can your leadership look at their coverage and adjust as necessary? And then again, visibility across communities, across various types of workers, and having an integrated system that can streamline all of the work for you. So typically, when it comes to filling your shifts today, you have a schedule that you've created that goes out sometime 2-4 weeks into the future, but inevitably you have someone who calls off and you need to fill that open shift. So the scheduler tends to scramble, calling internal staff. That may be going down a telephone list and starting at the top and working their way through, calling a group of people, texting them, trying to find someone who can fill that. If there isn't anyone internally, then next is probably calling multiple agencies to schedule independent professionals. It may involve the scheduler posting shifts on multiple platforms. We had one customer that we were dealing with who had 33 different staffing agencies that they were using at one point in time. So the complexity of trying to manage that. And if you do find someone who can pick up that shifts, having to go in and manually update the schedule in order to show that you've got the coverage. And then once you've done that, what happens if an internal employee calls back and says they're now available and they can pick up that shift for you? Well, then that scheduler has to call the agency back to cancel the shift. They may incur late fees, cancellation fees, those sorts of things. And then the scheduler has to go back in and manually update that schedule again prior to that person actually starting the shift. So it's a multi-step, complicated process, and doing it manually is time-consuming and involved, where technology can be your best friend to help you manage through this in a much, much easier way.
So we want to introduce you to Sammy. Sammy is a product delivered by ShiftKey and OnShift, an integrated solution that we worked on for many months to provide a community with a complete view of your schedule, showing your employees and independent healthcare professionals in one place and providing you with all the tools to build a complete schedule proactively, cost effectively, and as automated as possible. Just to give you a different diagram here than the one that Peter shared with you, when we say that Sammy prioritizes your employees, we really mean it. The goal of Sammy is not to add more outside workers to your community. The goal is to provide a safety net for filling your shifts so that your residents can get the care they need, your employees don't get burnt out, and your community can stay compliant with those staffing mandates. This technology works for you. You get a complete schedule in one place so you can optimize those cost savings and have the confidence that open shifts are going to get filled. And it really does drive more of your internal employed workers to access those unfilled shifts as well. Through the OnShift mobile app, employees can view and request shifts anytime, anywhere. Plus, you have the option to set budget guardrails. For example, you can automatically approve shift requests for employees who are not at risk for overtime, saving your scheduler time and helping them stay in budget, and again, having that unified schedule in an automated way. If your employees aren't able to cover all the shift openings, SAMI has you covered there. Your unfilled shifts and on-shift schedule will be posted to the ShiftKey Marketplace without your direct intervention during the time frame that you specified, not sooner. Most of our SAMI customers set that time frame at 14 days in advance of a shift to give them plenty of time to secure the best independent professional for their open shift. After that shift is posted to the marketplace on ShiftKey, independent professionals will request the work. You can view each of those individuals' credentials, their licenses, background checks, etc. And one of the key features of SAMI is that once an opening has been sent to the ShiftKey Marketplace, your employees can still see it and they can still request to work via the OnShift mobile app. If an employee picks up that shift, it will automatically be removed from the marketplace, even if that shift has already been assigned to someone, up until 2 hours before the start of the shift. You don't have to worry about overscheduling or cutting your employees off from having access to pick the shifts up that work for them. You can gather independent professional requests for shifts while still giving your employees the opportunity to pick that shift up, again, even after it's already been assigned. In the example on the screen, you can see a scenario where an open shift was posted to ShiftKey Marketplace 14 days in advance of the start, but an employee picked that shift up a few days after that. Since the employee picked the shift up, it was automatically removed. And again, that schedule was automatically updated to reflect that. What happens if none of your employees pick a shift up? SAMI fills that shift with a qualified, vetted independent professional between 1 and 5 days before the start time based on their reliability score and your indication of your favorite workers. In the example on the screen here, you can see a scenario where an open shift was posted to the marketplace 14 days in advance, again, of the start time of the shift. No employees were able to pick that shift up. And 5 days before it started, SAMI assigned one of the independent professionals who requested that shift, and their information was sent into the on-shift schedule in a unified and transparent way. After SAMI assigns an independent professional to your shift, you can still cancel their assignment and replace them with one of your internal employees anytime before that shift starts. For example, 5 days ahead of a shift, SAMI assigns a reliable CNA to that shift, but then 3 days before the shift starts, a CNA in your building says they're available to work that shift. All you need to do, go into the on-shift schedule, unassign the CNA from the marketplace, and your CNA can pick that shift up. You won't experience any fees or penalties. SAMI was a part of Touchstone Communities' workforce strategy, and it helped them achieve some pretty significant results. Not to steal any of Nicole's thunder, I'm going to pass the mic over to you, Nicole.
Hey, thank you, Brandon. Really an honor to actually be able to present today on McKnights with you and with OnShift. And we just feel very blessed to have you guys as partners with Touchstone Communities in Texas. I've worked for Touchstone for the last 3 years in the great state of Texas. Touchstone was formed in 1991, and we have a model of intentional investments in markets where there's a need. And one of our owners said, creating something that will be around a lot longer than we are. And so we're just so great that we feel very blessed that Carl and Stan have that vision of making intentional investments in these markets. We currently operate 27 skilled nursing communities. We have 2 active new builds underway. And that's just, you just don't hear of that in today's times. We were the first private operator of Texas State Veterans Homes with 4 in our portfolio today. And we are grateful to have near 3,000 team members currently choosing to work for Touchstone Communities. Boy, the last few years, we've definitely had a lot of challenges. And so we're currently in that position where we're looking at the occupancy recovery post-COVID. Everyone has had unprecedented staffing challenges and trying to figure out how do we overcome those challenges. And when we started this, ultimately, we were utilizing numerous staffing agencies. And if anyone's working in the profession today, I can't tell you, there's not a single day that doesn't go by that I don't receive at least 1 or 2 emails from new staffing agencies trying to work with Touchstone to bring in contracted employees. There was inconsistent assignments. We had waning team member and resident satisfaction. We were paying premium rates for just a ton of different agency companies. We didn't have any real-time way to track our actual hours of labor, so we didn't know if we were overstaffing or understaffing. And then we really struggled to gather all of the data from the different agencies and submit it to CMS for our 5-star rating. So when we started this process, we set some goals, and we wanted to increase our team member engagement. We wanted to consolidate our scheduling processes. We wanted to deploy our labor spend and to optimize that. Ultimately, we didn't necessarily want to reduce our spend, but we wanted to optimize our deployment of our labor spend. And then what could we do to continue to support our continuity of care? We recognized that we weren't able to fill all of our shifts on our own, but what could we do to help that continuity of care utilizing agency? And then our ultimate goal is how could we care for more patients, residents, and veterans in our markets that needed us most? So we, as everyone in the market, we incentivized our current team members. And so we gave them as much overtime as what they could work. We were offering shift pickup bonuses. And really a lot of our team members were they were picking the bonuses that they wanted because we were desperate and having enough people at the bedside of our patients and our residents. We gave referral bonuses and retention bonuses and sign-on bonuses and increased wages. And even after all of the financial incentives that we could think of giving, we still had holes in our schedule. And we faced that fact that we had those holes. And we also, when you're giving all of those bonuses, you're running the risk of burnout with your current team members. So one of the things with Touchstone is that, we've got some of the best leaders. And Carl and Stan and Brian and Leslie, ultimately, when our purpose says that we glorify God, they mean it. And that means that they're going to do what's right, or they empower us to do what's right, no matter the cost, for those to provide care for those that God has entrusted us to care for. That's not only our patients, our residents, and our veterans, that's also our team members. We feel that we're entrusted with our team members, and we need to provide care to them as well. And we found that money, it matters. Ultimately, it matters that we provide a quality living for those that are caring for our patients, our residents, and veterans. But we also found that culture, that's what matters most. So we had this Touchstone, this workforce transformation. And so we actively listened to every one of our team members' voices. We found that was critical. We had frequent two-way communication with our team members. We found out what was important to them for recognition and support. It wasn't what mattered to us as leaders of the company. It's what mattered to our CNAs and our LVNs and our RNs who were at the bedside of our patients and our residents. What really made a difference to them? Then we looked at that total workforce optimization, and then we had a strategic recruiting and onboarding committee of what can we do differently moving forward. And so none of these work on their own. We found that we couldn't just listen to our team members. We had to go through each one of these steps in order to impact total team member and patient satisfaction. So the most important thing was hearing the voice of our team members and recognizing that every voice matters. And so we found that we couldn't do just an annual team member engagement survey. We had to have frequent outreach. We call these pulse checks with our team members. And so we have these new hire surveys. We use on-shift messaging, team member engagement surveys, pulse, annual, and exit surveys. And these results don't just go to the administrator or the director of the nursing. They go to our COO and the VPOs and then to the administrator. We look at the historical trends. We've looked at, why are we losing team members in less than 90 days? And then we do these quick pulse surveys that go to our team members' phones, all through on-shift messaging, and through another vendor partner. And we're able to provide regular opportunities for feedback. So once again, moving beyond just the annual surveys. What we found is with on-shift, with the early payment in regards to a lot of our team members, when they get towards the end of the payroll, they're short, they're challenged when it comes to meeting their bills. And so we did this food and fellowship where we're providing food for them in the break room. We have food and fellowship where we have informal feedback in the break rooms, where they're meeting with the administrator, they're meeting with the department leaders. And then these pulse survey where we're capturing quick information and actionable insights. And what's really important is that we have to act on the information that we gather. If we can just hear them, but we don't act on it, that's more detrimental than not seeking to hear the voice of our team members. And so that action part is critical in influencing change. So what we wanted our team members to know is that their voice, it matters, and that we have the best-in-class benefits for best-in-class team members. And so, as I'd mentioned, those wages, they matter. And then we included direct care nursing staff. We include them in our team making decisions. We include them in staffing ratio decisions. We include them in budgeting purposes, for current and for future years. And we also include peer-to-peer interviews. And so if we're interviewing a CNA, we want another lead CNA to be part of that interview process. We love to get their feedback, but what it does is it creates a partnership, a bond. And so if they sign off on the hiring of that CNA, they embrace that CNA on day one, and they want them to be successful because they were part of that interview process. We looked at the workload of our nurses and of our CNAs, and how can we lighten that workload with technology and with modern equipment. We empowered our charge nurses to take charge. We did a pilot in one of our communities, and we increased the wages of our charge nurses, but we changed their job description. We empowered them to be over their CNAs, to be over their patients and their residents on that unit. And so instead of going to the director of nursing for everything, the team members go to that charge nurse who's been empowered to manage their unit. And we looked at the time spent on non-nursing tasks that could be delegated. And so we made Touchstone, as our director of clinical for all of Touchstone, she says, make Touchstone an easy place to work. And that's our goal, is making Touchstone an easy place to work, where our team members want to come to work. And we looked at that work-life integration. We want our team members to love coming to work, and that they think about our patients and our residents outside of work, and it just becomes part of who they are. So that acting on that feedback with that work-life integration, we're still in the process of doing this, of what's the best schedule to meet the needs of our team members, and everybody's different. And so we offer options. As it was mentioned earlier, that flexibility, it's so important to have flexibility. And so, no, we can't have them handpick their schedule because we want to have those consistent assignments, but we do offer up some different scheduling. And we found that 8-hour and 12-hour shifts, those are ideal. And so we do the combination of 8-hour and 12-hour shifts. And we offer up the wagon wheel, the every other weekend, the 4-2. And so our team members can anticipate their schedule, and they can look in on shift and they can know exactly what their schedule is. I don't care if it's 10 years from now. They're going to know exactly what their schedule is via on shift scheduling. and having those consistent assignments with the consistent rotating pattern. And so they can plan out vacations and well in advance. The mobile app, it improves our communication and it helps us with our budget adherence. Plus, we can auto assign. And so I should say our team members, if they're not in overtime and they look at their paycheck and they're an on shift and they want to say, hey, you know what? I've got something special coming up and I'm going to need a little bit of extra cash. With their on shift scheduling, they can pick up a shift. If they're not into overtime, there's no work on our side at all. It'll auto assign them to that shift. They automatically get that shift and it's in their schedule. And so it's great. It saves us a significant amount of time. Plus, it empowers our team members to make those independent decisions. So that provides support and recognition. Oh, this is something that we love doing at Touchstone. We love to celebrate our team members. And last night at THCA, we had 2 of our team members win. We had one win, the director of nursing for the year in Texas, and we had an administrator win for the administrator of the year in Texas. And so you see this breaking news, but ultimately that literally just happened last night at THCA. We're just so proud of the many things. And so we love to draw attention to our team members as a team and independently as they reach personal and professional goals. And we love to do this via on-shift messaging. We personalize our messages via on-shift messaging. We do this via team talk, emails. We send out postcards. We do email blasts. We've got this Shine Bright Survey Excellence. And so as a team, ultimately, we all win together. And so we've got this financial incentive for our team members that when we have survey excellence, they win just like we win, and our patients, our residents, and veterans win. And their pocket grows a little bit from it. We encourage our personal and professional growth from within. We want to grow our own nurses aid and training. And we want to help people become CNAs. We want them to become passionate about long-term care. We have administrator in training and DNS mentorships. We find reasons to celebrate the one, and we find reasons to celebrate collectively as a company. And then just those other simple things of saying thank you, the lunchbox programs, shoes for crews, scrubs, gym membership, daycare reimbursement, anything that we can do because we heard the voice of our team members, we implement them into our daily routines. Another thing that's been a huge blessing is on-shift wallet. So when our team members are running short at the end of a pay period, instead of incurring significant late fees or overdrafts, they're able to meet the needs of their family by withdrawing part of their earned money ahead of time with, I think it's a few dollars. And so it's just a simple way that we can bless the lives of our team members. This has been really huge for us, this Make Lives Better Foundation. And so we encourage our team members to just give. If they give $1 a pay period at the end of the year, we have 2 pay periods a month, and so at the end of the year they've given $24 in to this relief fund. And this grant program is for all of our current team members and previous team members. And we get the most heartwarming and heart-wrenching stories that come through of people that need part of the Make Lives Better Foundation grants. And so we give up to $1,000 to help in times of hardship. And we've had team members lose their children. We've unfortunately found team members that have passed away, and we've helped provide services for them. We've helped at end of life for our team members. When they have a hardship, we want to be there for them by offering them this financial grant. And the beauty of it, it is completely self-sustained by Touchstone team members. They're the ones with generous hearts that give in to this Make Lives Better Foundation. They're the ones that provide care to one another. So achieving our goals, we've strategically utilized independent professionals. And I'll tell you, before COVID, I would have said, absolutely not. We can't have agency in our communities, but we recognize that it's a need, and we've made them great partners. ShiftKey has been fantastic partners when it comes to providing agency team members. And so with the ShiftKey on-shift integration, we have this real-time insights allowing us to make strategic workforce decisions. We can easily see where and when we need extra help to support quality resident care. And we seamlessly integrate our schedule with marketplace of independent professionals and use automation to be more strategic about what shifts gets advertised to temporary workers and how far in advance those shifts are advertised. It also allows us to consistently meet staffing ratios so we can maximize Medicaid reimbursement and achieve our Texas QIP requirements and achieve our 5-star quality ratings. So creating a staffing safety net, that's what this partnership has done for us. We have the integration between our scheduling platform OnShift and the ShiftKey marketplace turned on all the time, but it does not mean we use it all the time. It's there for us when we need it. Temporary workers are a safety net, as I'd mentioned. We use them only when we need them to, but we don't always have to use them. And so our goal is to not use them, but if we have to use them, we want to use this integration to provide consistent assignments. That ShiftKey chart that you see our temporary worker spend and hours have gone down after a time when we needed to staff up. And so like what was mentioned earlier with Peter and with Brandon, we had a time where we were experiencing this growth and we weren't able to fill the gap with our own team members. And so we shifted OnShift and ShiftKey agency workers, and we use them. But as time has gone on and we've been able to recruit our own team members, that spend and the hours have reduced significantly. It's reduced the risk of burnout, it's increased our hiring, and it's increased our ability to care for more residents and providing quality care at the bedside of our residents. So technology for total visibility. And this is what's been so fantastic about our partnership with ShiftKey and OnShift and the SAMI integration. We can see everything that's going on within the system. And so we can meet the needs of our residents, make smarter hiring decisions, and we prevent that overstaffing. And ultimately, with SAMI, our entire workforce is in one place for easy reporting for daily staffing, Outlook, and quarterly PBJ reports. The ShiftKey integration with Prime that we have, and ShiftKey helped us make this happen, it allows us to see all of our labor reports real time, including ShiftKey workers. And we've got this OnShift integration as well with PBJ and with ShiftKey, and it helps us achieve a perfect balance of regular hours, overtime hours, and temporary workers to provide quality care. We found with this integration, it's improved our consistency for high quality care. It's reduced our unfilled shifts. The direct connection between our scheduling platform and a staffing marketplace has made it easier and faster to fill those unfilled shifts. The integrated technology automatically sends budgeted unfilled shifts to the ShiftKey marketplace. Our team members can still pick up those shifts, but if they don't, we have a safety net in ShiftKey where independent professionals are requesting that shift. Then the scheduling templates provide consistency because it flows right back over. It's more convenient for our team members. It's easier for us to spot gaps in our staffing, and we can curate our independent care network by selecting our favorite workers. And that's such a great thing is that when we build a relationship with these temporary workers, we mark them as our favorites. And so they're the first to pop up when we've got an opening, and it can be auto-assigned to them where there's no work involved for us. And we've got this relationship with these temporary workers. So they're like one of our very own. It's helped support hiring and retention. We've had success hiring independent workers as full-time team members, using the ShiftKey marketplace as sort of a try before you buy, in a sense, recruitment approach. And so we're able to utilize these marketplace employees, and if they're a good fit, we're able to hire them on at no cost. And once again, we already know they passed the Touchstone heart test. They're a great fit for us, and it's a smooth transition going from ShiftKey over to Touchstone, a ShiftKey employee over to a Touchstone team member. So when selecting independent workers, we add them as our favorites. We look for a culture fit. The favorite feature creates consistency with independent workers, which leads to independent workers building connections with our residents and with our team members. It also helps us avoid this us versus them mentality when independent workers pick up a shift at one of our communities. They're not just an employee. They become one of us, one of the Touchstone team members until they officially become a Touchstone team member. We found using SAMI, we've had a reduction in turnover from anywhere from 13 to 27% in our communities because we have enough team members at the bedside of our patients and our residents, and it's reduced the risk of dissatisfied Touchstone team members, and it's increased their satisfaction at our communities because they are able to provide the quality care and the reason why they come to work every single day. So the SAMI integration for us, it's helped us to optimize our workforce cost savings. We avoid overtime with auto approval in on-shift. We've eliminated premium temporary worker cost and last minute shift incentives with our own team members. We have this total workforce visibility, which I love, and it removes the risk of costly scheduling, overscheduling, and more importantly, underscheduling. We want to make sure that we've got the right amount of team members at the bedside of our patients and residents. And it saves our schedulers just a ton of time, juggling multiple agencies or calling around to team members to fill shifts. It's allowed our team members to truly be at the bedside of our patients and residents and to provide the care and services that they deserve. The partnership, just focusing on this partnership, in general, Touchstone looks at our partners as being crucial to our workforce success. This partnership has really helped us prepare to be ready for growth. And so we, as I'd mentioned earlier, we've got these 2 new buildings under construction and 145% census growth at one of our communities. And I just want to show you that ultimately with this partnership with ShiftKey and OnShift and this SAMI integration, we've increased our ability to care for 180 more patients, residents, and veterans. And that's largely at or above pre-pandemic occupancy levels. And, increasing our patients served by 180 required 540 more hours of direct care labor per day, which is 72 more nurses, CMAs, and CNAs to provide that care. And so Brandon and our relationship with ShiftKey has made it possible for us to grow those 180, to increase our patients served by 180 more residents. And that's what we're in the business to do, is to be able to provide more for those that God has entrusted us with. And so, Brandon, we're grateful to ShiftKey and for our partnership and for the SAMI integration, who's made it a smooth transition. And so with that, Jim, that's the end of our formal presentation, but I do understand that we've got some questions. So I'm going to turn it back over to you.
All righty. Outstanding. Thank you, Nicole, and everybody. Brandon, Peter, just great stuff. Always workforce matters are so important. And we'll jump right in. Brandon, I have one for you. Raymond asks, is ShiftKey an agency? Straightforward question.
Absolutely. Well, first, great job, Nicole, and congratulations on Touchstone Communities growth here over the last many months. They're lucky to have you. I certainly value the partnership as well. And while Touchstone is a special organization, the results that they're seeing aren't isolated only to Touchstone. We've got hundreds of communities that are using SAMI and seeing increases in their occupancy as well, seeing decreases in their unfilled shifts and better cost control to help them grow. Warms my heart to be a part of it. Keeps me connected to the business that I've loved for a long, long time. So one organization that uses SAMI has seen their highest shift fill rate in 2 years. Another organization that I've got some stats in front of me on grew their occupancy by 7% across their portfolio of communities. Another decreased their overtime by 30%. The industry is taking notice too. Shift Key and OnShift have actually been recognized as a finalist in the McKnight's Excellence in Technology Awards for our development of SAMI. We're excited about our candidacy in that exciting contest.
All right, great. And I'll note that we are having our award ceremony where we'll unveil the winners on that later this month. And so we'll keep that under wraps for now. But I did want to toss it back to you quickly, Brandon. There was a question. Is Shift Key an agency? Someone asked.
Yeah, great question. No, Shift Key is not an agency. Shift Key is a workforce technology solution. We provide a marketplace for independent healthcare professionals and healthcare facilities to effectively, transparently, ethically connect directly.
Okay, very good. Let's see if we can get a question to each of our other panelists quickly here. Peter, we've got a question from Jackie. Where do you see the senior care workforce heading? And do you think using temporary workers will be a trend that'll eventually fade away? Now, that's a loaded question. I want to ask you, give me your best minute or so.
Sure. Thank you, Jim. And again, thank you, everyone, for joining. We really appreciate it. The answer is no. I don't think this is a trend that is going to go away. You just have to look at the demographics of the increasing demand, coupled with the increased staffing requirements that are out there that states are enacting, and the federal minimum standards that are proposed, and couple that with the aging of the population of healthcare workers. 30% of nurses are looking to retire over the next 10 years. There's not enough new immigrants coming in, new nurses graduating from nursing school to be able to fulfill that gap entirely. So just purely on a demographic perspective, there was an article actually just came out today, a report on frontline workers, CNAs, home care workers, those sorts of things, and the increased demand and lack of supply for those. So yes, we have made incremental gains in terms of encouraging people back to the workforce and employers being able to hire employees directly. But the need to be able to supplement that in order to provide flexibility, in order to meet the care needs, that's not going to go away. It's got to be something that as providers you accept, you acknowledge, you embrace, and then you work strategically and intelligently to be able to do it, to utilize them in the most cost-effective manner possible.
All righty, sounds good. Now, Nicole, I really want to get this one to you here. Hopefully we can take a few quick seconds. Peter writes in, how do you convince temporary workers from the Shift Key marketplace to transition to become a full-time employee? Very important for a lot of people, I'm sure.
Yeah, that's a really great question, Jim. And, you know, for us, we've got this partnership with Shift Key. And so we do not actively recruit any of their temporary workers. You know, it's our goal is to ultimately have these workers come in and they fall in love with Touchstone and our culture and our purpose and our mission and our values and our beatitudes. And so we treat them like one of our own team members. They become part of the Touchstone family. And then we do a great job educating all of our family of the benefits that come from being a full-time Touchstone team member. And then they fall in love with our purpose and our mission, and they come to us seeking employment. as I'd mentioned earlier, we kind of get to try them out. And so we then are in a position where we can choose to hire them on if they have a heart for the business and they truly want to make a difference in the lives of our patients and our residents, and if they want to make lives better. And so we just, we do what we do best, and that's providing quality care, and we lead and we serve. And ultimately, we want to bring those along with us that are a perfect fit for Touchstone.
All right. Very good. Now I'm going to go to my favorite question. I told you all it would be coming, and I'd like your best 30 seconds on each of these, because it is going to be, what is the one thing that you need listeners to leave with today? Nicole, I'm going to go with you first, because we've talked about many things, but what is the one thing that listeners have to leave today's presentation knowing?
Oh, Jim, you had to start with me. I want to say, don't be afraid of new technology. We were part of the pilot with OnShift and with ShiftKey with this Sammy. And, we helped build this with them. We don't have any partnership with them other than they truly are our vendor partners. But this technology has made such a difference for us. It's reduced the amount of time that we take with scheduling. It's increased our resident satisfaction. And so, just going back to don't be afraid of technology.
Oh, okay. I didn't mean to cut you off. I'm sorry, but excellent stuff. Brandon, what is your one must take away?
Yeah, I leave you with the comfort of knowing you're not alone, and that there's reason to be very optimistic, and there's technology solutions out there to help you be very successful.
Very well put. Peter, your one takeaway, please.
Yeah, we're all in the business because we want to provide the best possible care we can to the patients and residents that we're entrusted to look after every day. At the end of the day, there's more to do than we can possibly get done. There's just more demands. And so embracing technology to find ways to be able to maximize your contribution to your overall mission is a win-win situation.
Hope you've enjoyed this webinar. We want to give our special thanks to Nicole Kumala, Brandon Tappan, and Peter Corliss for some great insights. We also want to thank our session sponsors, ShiftKey and OnShift. Visit them at onshift.com. And we want to thank you, our listeners. You've been a big part of the success. We look forward to seeing you again at all of our McKnight's webinars. Once again, thank you for tuning in. This is Jim Berkland from McKnight's, wishing you good health and outstanding days ahead.